Hello. For the sake of this, I'll remove my mask because, of course, in theatre we should be in masks. My name is Dr. Gabriel Okumu, head of surgery department in Nakasero Hospital. I've been here from 2016, so that is about, coming to what, 8 years? Yeah, Nakasero Hospital has been in existence from 2009. So ever since we started, it has been offering surgical services. And over the years, we've been improving the services that we offer in Nakasero Hospital. So currently, our surgery department has almost every surgical procedure is done here. We do orthopedics, we do neurosurgery, we do abdominal surgery definitely, we do ENT surgery, we do cardiothoracic chest surgery, we do plastic surgery, and also the other side of the obstetrics, the women's side, we do obstetrics and all kinds of gynecological surgeries here. Currently, we've been offering services, and one of the things that are relatively new here is laparoscopic surgery, or what we call minimal invasive surgery. And in that, the newest service we have currently is we're trying to improve on our, what I may call bariatric surgery, or weight loss surgery. The services for weight loss, the demand is increasing in Uganda, especially Kampala. So we have a good number of clients who come for weight loss surgery. So now we do weight loss surgeries here. We offer balloons for weight loss that make the stomach size, the stomach volume smaller when somebody wants to cut weight. We also have gastric plication surgery. We make the stomach smaller by plicating it, putting stitches. Then we also have the sleeve surgery, where we cut the stomach into half and then make it a sleeve, and then the person's stomach volume becomes smaller. We also offer bypass surgeries for weight loss. And we have a good number of clients who have benefited from these services. What we intend to start in the nearest future, which we're actually starting most likely this month, is want to start what we call ERCP, that is endoscopic retrograde cholangiopancreatography. That's a surgery where somebody has the stones in the gallbladder and the person gets a complication where the stone is going to the tubes, and then there's a special way of to remove those tubes. We get quite a number of cases with this, and the services are there in Kampala, but not widespread. So as a hospital, we think this one of the services we're going to start soon. So soon we're starting. We've already done the training. I did training. Another colleague of mine, Dr. Koyama, did training. Our nurses have trained. So the team is ready and just trying to organize ourselves to start soon. Also, among the new services we have as anesthesia side, also improving. But generally surgery, I think we are trying to improve on what we already have. We're trying to expand on laparoscopic surgeries. So right now we're trying to offer almost every kind of laparoscopic surgery for the abdomen. And I thank God that, I think, as I see as the years go by, most of the doctors now are adopting laparoscopic surgery or minimal access surgery. So we are doing less cutting, especially for all cases that can be done without cutting. We're trying to make sure we can do them without cutting, and that's what we're trying to improve here. And one of our goals as Nakasero Hospital is to be a center of excellence for minimal access surgery. That's why the orthopedics are doing the arthroscopies, the ENTs are now doing the face surgery, and they're also doing brainstem tumors, cancers below the brain without cutting. They're just passing the nose and do them. And also the gynecological team is also doing well, because of late we are doing the hysterectomies, removing the uterus, removing masses or swellings in the uterus, and also all surgeries basically. Another area where we're trying to expound is in hemorrhoid surgery. That is swellings in the anus that cause people to bleed and get pain and have difficulty passing stool. We now offer laser surgery. Well, I've done that for some time, but I'm trying to improve on laser surgery for hemorrhoids, which is something good. On the side of urology, we're also trying to improve on our surgery, which is minimal access. So we do endoscopic surgeries, especially stones in the kidney. We see quite a number of clients, especially Caucasians, the Indian race, also is common among the Ethiopians, the Eritreans, who come with stones in the kidneys. So our team is now trying to remove the stones from the kidney up there without cutting patients. So we thank the team, the management, the hospital, the board for all the support. Yes, part of the services we offer here is that, of course, we have to work with several departments. Like I've talked about the weight loss surgeries. You cannot do weight loss surgery as a surgeon alone. When you're doing weight loss surgery, you have to have the nutritionist on board. You must have the physician on board, because a good number of them have other conditions. Somebody comes with big size, they're obese, but they also have diabetes, they have hypertension, their joints are weak, and many times they have other conditions, what they call the syndrome X. So we work in conjunction with other team members. Nutritionists has to be on board, even psychiatrists, because a good number of them are depressed. They really feel, in fact, many people become big because of depression. They eating their way out of trouble. So the psychiatrists also play a role in a good number of the clients. Then also in collaboration, work very closely in hand with the anesthesia team, because surgery cannot do without anesthesia. You can't cut when somebody is in pain. So we work with a team of anesthesia. They make the patient sleep, make the patients comfortable, then we do a surgery. Then also we work together to offer pain after surgery. Surgical care after, we always do it as a team. One of the areas that are trying to improve so much in Nakasero is what we call the ambulatory surgical services. That means a patient comes in the morning, you do a surgery, and they go home in the evening. It's very good. Why? The patient will go back home. That means the relatives don't have to come to hospital. The patient can stay home. Most of them are mothers, fathers, so they don't have to stay with their kids. They can go back to stay with their kids at home. Then even for the hospital, the cost is less. Come for the surgery and then go back home. So you can even resume work quickly. And that is one of the biggest advantages of minimum access surgery, is that patients can resume work sooner than before. So we're trying to improve that area of ambulatory surgical services. So the nursing team, of course, plays a very, very big role in that. If you operate somebody today and they go home tomorrow, you have to find out how they are. So there has to be somebody to call them and find out, how are you? How have you done? How was the night? Was the pain bad? Is there any bleeding? How is the wound? How is the dressing? If need be, we send teams to go home and look at them and see what is happening. So we work hand in hand with many departments. Also within the hospital, in the inpatients department, several times you have to work with a physician. The physician is treating a patient. The patient reaches a point where they are vomiting so much, they are not passing stool, so we have to go and see as surgeons also. So we work interdependently. We need each other in the hospital, all departments together. Pediatrics, they have some pediatric cases they call us to see. Gynecologists, at times they're doing surgeries, they get stuck, the intestine is stuck on the uterus, they call us, we go and work with them. Even sometimes we work and find that the problem we thought was appendix actually is an ovarian problem. So you have to call them in and work together with the gynecological team. So there's so much interdependency in the work we do in the hospital, which is something good. Another side we don't mention, sometimes the spiritual side as well. We also need counseling. Many patients need counseling. So we have psychologists who do that very well, and we work hand in hand with them.
Pre-operatively, we meet our clients through calls. We let them know that we are their service providers and we are here to give them safe surgeries, and we remind them about the surgery time. While they come in, pre-operative care begins with the nurse by receiving the patient through the main reception. She reassures the patient, introduces herself to the patient, and affirms to them that they are the right nurses or the right team in theatre to take care of them, and they calm their anxieties right away from the main reception to the reception of theatre. As they come in, that is all pre-op. However, this also goes with making sure they give them the right attires. They make sure their ornaments like rings, earrings, watches, they are valuables mainly that can be kept safe, but also during surgery that they are not electrified. That is all pre-op. Then intra-op, they support the patients through signing out and time out. What do I mean by this? We affirm that this is the right patient by the nurse, who is the circulating nurse, makes sure she introduces the client to us, goes ahead to tell us what we are supposed to do, confirms the surgery, confirms the team by making sure we know who are the team members ready for this surgery by mentioning their names, what are their roles, and then after that, we affirm the time of surgery, and inside still the theatre, we make sure that there is a board. This board affirms to us whatever we've said in the operation room, that is the right information, so that patient safety is kept as a key standard operating procedure.
So one of the new things we're having is that we are having an expansion, and currently Nakasero has 2 operating theatres which can do all surgeries. One has a C-arm, one has no C-arm. And also we have another, what we call a minor theatre, where we do the endoscopies and other simple things. But very soon, actually the new building is up, and we have begun the occupancy. The outpatient department is now functional. The pharmacy is functional. So in the new building, we're going to have 2 more theatres. So all in all, we hope by maybe in a month's time, we shall be having 4 operation theatres, which are all functional, which can all do any surgery possible. But of course, shall kind of make them specific. Some to be for the orthopedic, maybe neuro, cardiothoracic, then others to be Caesar and other things. But you shall have 4 theatres. That will improve our services definitely, because you shall have more space for operation and space for recovery. The new theatres will be a bigger recovery area, a bigger waiting area, a bigger. Right now we are squashed in space, so our patients really, we apologize to them because they struggle when they come here. The space is smaller, but with time we're going to have an expansion, have a bigger theatre, better services. We shall have, of course, new things with the new theatre, new operating bed, new lights, new anesthesia machines. I think the team will get bigger definitely. So I believe the services are going to get better for the patients.